Okay. Yeah. So thank you, everyone, and welcome again to the Zimbabwe Digital Health Society's monthly webinar for the month of September. We're happy to have you here again. For those that might be joining us for the first time, the Zimbabwe Digital Health Society really is a community of practice. By that, we mean we are a group of individuals from diverse backgrounds, whether we are medical practitioners, technology developers, entrepreneurs, representatives of NGOs, people that are invested in the digital transformation of healthcare, people that are even studying it, whether you are a student in one of the various affiliated disciplines. It's all about us coming together and sharing our experiences so that then we can then get to um, dictate how or direct the discourse of things. One of the tragedies that I have witnessed is people that have never used telemedicine be the ones that end up drafting policies for telemedicine and it's that kind of chaos. So we want to avoid that scenario by filling that void to ensure that people that are invested, people that are involved in the application of technology in health are the ones that are consulted, are the ones that are maybe actually direct what's needed for us to progress, rather than wait for things to be brought onto us. We want to be able to actively contribute towards that process and not just be passive passengers on this bus that is being taken to a place that we are not aware of. And by doing that as well, we then also want to help each other through collaboration. Many a times there's a repetition of solutions. There's a lack of of information. But yeah, through us regularly meeting, through us establishing connections, knowing who's doing what and where, we then can share those experiences so that we all advance the digital transformation of healthcare in Zimbabwe as well as around. So once again, welcome. So this follows our last webinar, where Dr. Jokwiro kind of gave us a good platform to start from, where he kind of went through an overview of digital health in Zimbabwe as well as in neighboring countries, and sharing his experiences with Zim Smart Villages. So there are many things that he touched on, whether it's from policy, whether it's from infrastructure issues. There are many things that he touched on. And for those that missed that session, if you go onto our LinkedIn page, you will find a video that's there, a video recording, so you can then catch up. And yeah, you're welcome to add any questions or comments to that video so that we keep on continuing the discussion. So today it's my privilege to be touching on a very important development that is the Impilo National EHR, which the Ministry of Health and Childcare in Zimbabwe is championing, is driving, and then to look at how it then relates with those in the private sector. By private sector, it could be a private practitioner, nurse, or doctor, or someone in the imaging or laboratory, or you could be working for an NGO that is coming up with digital health applications, and then there are a lot of them in Zimbabwe that are working on such solutions, whether in TB, in malaria, in HIV, diabetes. So we are all kind of like then out of government, and then trying sometimes to look in and understand what the government is doing for us, what the government is building, so that we then can position ourselves. So that's what the focus of this webinar will be about. And later on, really, it's about it being a discussion. So we'll open up and then get to hear from your experiences, get to hear your reactions, so that together we then shape the discourse. We then get to understand where we are going, and we drive that process. So just a bit about myself. I'm a medical doctor by training, trained at the UZ, but then I kind of discovered quite early on what technology could do. So through the field of e-health, when I was still even an intern, I realized that technology could achieve, could solve a lot of our perennial problems in healthcare. So that led me to then kind of pursue a full-time career in digital health, where we develop solutions and implement them. And that's also involved, policy work, where we realize that now it's not just about building applications; it's also now about having the favorable environment through regulations and policies that actually allow us to get there. Um, and I'm a member of various international associations, but I'm really proud to be with the Zimbabwe Digital Health Society because, yeah, this is our time. We are the guys that are on the ground in Zimbabwe, and the transformation of digital transformation of healthcare in Zimbabwe is going to be driven by us. So happy to have you guys join us, and we're already getting close to 50. So thank you, and we look forward to this growing. We might get to talk a bit later about the Zimbabwe Digital Society, but please just keep for now keep logged in and follow our LinkedIn page. There are a lot of updates then that are then provided up there, so that you then get to keep up to date with all our events and everything that the site is on as we build this thing together. Right. So we are talking about Impilo. For those that might be hearing this for the first time, Impilo is the name given to the National Electronic Health Record System that the Ministry of Health and Childcare of Zimbabwe has built, and its purpose is to then digitize the operations, the clinical, the whole health system of Zimbabwe. I kind of like this homepage for their application for their web app, that they put the image, particularly the image that is there. It then kind of shows what it is that they are trying to achieve or where we are coming from. So really, it's about moving away from paper-based systems. As you can see there on the desk, there would have these thick registers where nurses, doctors, administrators have to enter information on a paper record, and then slowly that information gets its way up to ministry, and where it's then aggregated with information from other areas and entered into DHIS2 and so forth. And some of these books, you just look at them, the expense of printing them, how heavy they are to carry around, and then storage of those books. And many of them are then put in the files behind there, and that then seems to be data that is somewhat locked away. And also, this image also kind of shows the history of Impilo, where it came from. These green folders that you're seeing here are folders used in the HIV program. So every patient that is receiving antiretroviral therapy would have their own kind of like folder with an account name there, which then keeps track of their progress, their viral load, their CD4, all their clinical management. So everyone would have a folder that is there. But as we can appreciate, it is inefficient. It comes with a lot of redundancies, and so it was through trying to digitize this program that we ended up with a drive for digitizing the entire healthcare system. So the initial solutions were for digitizing the HIV program. Then there was a solution for the TB program, and then those were merged. And so, module by module, they've been adding more services to Impilo to then make it cater for all the various departments or health conditions. It also indicates some of the ministry's partners, or because most of the considerable amount of the funding for this program, which started way back in February 2015, has been from PEPFAR. PEPFAR, that's the U.S. government's aid for the HIV and AIDS response, and through PEPFAR and other partners. That's how they've managed to then build this, including other partners coming in to help on the infrastructure side of things, UNDP, and a lot, and even the government itself has devoted a lot of government of Zimbabwe resources towards Impilo. Because they really value Impilo as their flagship. So we'll then get to dive a bit deeper into like what Impilo is all about. And to kind of simplify it, this again is a simplified diagram of the enterprise architecture for Impilo. So it just kind of shows how its makeup. And one thing that I would want you to understand at the beginning here is that Impilo is not just one system. It's an ecosystem. It's a whole kind of like digital health platform that they're using. So the Impilo is then used as the banner that many other applications will fall under. So what you might have seen in the previous slide was just maybe the interface to the electronic health record, but that's not the entirety of the system. This kind of then shows all the other components of that ecosystem, that we have a solution for the laboratories, a solution for the pharmacies that's handling all the logistics and inventory. But then it's then connected to other databases and other systems, like for client registry, a system that records all the clients that the ministry has, one for the provider, one for all the health facilities. So all of these various databases are then communicating through the health interoperability layer here. So this is the core of Impilo, interoperability layer here, where we have various applications, various databases being connected to each other, exchanging information. This is built on the OpenHIE standard for interoperability, and it's a great way to set up your system, to ensure then that we do away with silos. Many of the people that have gone before us, or many countries that have gone before us, ended up with healthcare systems that are in silos. But emphasizing interoperability as the core then ensures then that we do away with silos, and it even becomes cheaper when we then want to update. So it's really a great thing that that they've done to build the system with interoperability being at the core. So you then have someone maybe going to a clinic, and then they are being attended to using the electronic health record, the Impilo electronic health record, but then all their information then gets reported into the national database that is using DHIS2. So what the ministry are excited about is the ability to get real-time data, instead of waiting for reports to be put together and then reported every week, and then this will be reported on paper every week, and then it then gets to a district level, where then it gets aggregated, and then maybe every month then gets sent up. Now it's possible to then get real-time information, allowing coordination or continuity of care, so that you then can have various healthcare disciplines working on the same patient, or even different facilities. It could be a clinic actually being able to cooperate in real time with a central hospital to take care of a patient. And so what that also then means is that they are possibilities for other systems to be plugged in there. So it's not just about having web-based systems. They are also going to have a suite of mobile apps. There's talk of Impilo Engage, which is then the mobile app that maybe we will get to download as citizens, or it's the one that's going to be given to community health workers. But there are resources that are there in that app. There's then ability to then even do telemedicine, so that you then can do video calls. So this is what they are building. Some of it is already finished. Some of it is still work in progress. But definitely they are they've way advanced with the stage that they are at. They are closer to the finish than the beginning, if I may say so, because it's been a long time in the making. And last time I was hearing from them, they had deployed in over 1,800 facilities. It's a massive project. It's not just about technology. I think many of you that are in this space will then admit that it's not just about you designing your perfectly working app or a system. There's also then the human resource element or human factor to it, where you then have to train people to then get to use this consistently. And then also there's need for supportive infrastructure. And so some of those things are the basic building blocks, as Dr. Chokuro mentioned in the last webinar, the basic building blocks required for any digital health platform to work. It's a massive undertaking, but there's commitment, and the partners, the government, and the guys working on it are forging ahead. So in the ministry, all this effort is led by Dr. Simka Izisho. He's the director of health informatics and data analytics in the ministry. And then they actually have appointed a national EHR coordinator. That's Dr. Robert Gongora, to work on this. And then they have other team that's supported by Zimtech, which is the technical partner that's helping them with the designing of this system, with funding from the partners, the PEPFAR and CDC and so forth. And these guys have gone everywhere, whether it's Zambia, Kenya, Ethiopia, learning about how those countries are also digitizing their systems and then bringing those learnings into this. So it's quite advanced. But this is it. It's like I said, it's not one system. It's an ecosystem of applications all under the Impilo banner. So it could be Impilo, the EHR. It could be Impilo Engage, which is the mobile app for maybe telemedicine or community health workers. There's also a laboratory information management system, a logistics information system, all that might all carry Impilo branding or logo. You can find out more about this on they actually created a dedicated website just on Impilo, so you can dive into there. There's even then a shared health record that they are working towards, which will then allow the system to communicate with external maybe providers. So this could be a patient who's been assisted in government, but now is going to private. There should be a way through there for that record to be passed on. We had to find out really how they want to do this, but it just shows that the key element here is interoperability, having various databases, various applications being able to exchange data such that then we then deliver one thing. So when a patient presents to the clinic using the electronic health record here, what is happening there is their record is fetched from the client registry. The provider or the doctor who is attending to them, their data is also fetched from there. The facility from which they are working for, the system fetches data from there. And then if they are given a diagnosis, it fetches from the technology service. So it's all putting this information together. If a prescription is written, then it's supposed to then communicate with the pharmacy system. So it becomes one thing that people might see as this, but underneath the hood is there are various databases, various systems, all exchanging data through the interoperability layer. This is a bit more complex, not even complex, but when they then try to show how every one involved in the healthcare delivery chain gets to be involved in Impilo. So we have client-facing services like this for the patient, and then we even have ones for the provider, and then they have for health insurance that are called the payer here, and then even then for the supply chain. So all these various systems, whether it's the one for remote monitoring or health education, or the one for lab or pharmacy are all communicating or linking through the interoperability layer, which is at the center here. So even its payment systems, everything is just anchored on the interoperability layer. And they've kind of tried to mention some of the things involved in there, the registry for facilities, like I mentioned before, disease registry, drug registry, and yeah, some of the standards that they're using to ensure then that all these speak to each other. And then they've even added room for AI-driven insights. That, as you can imagine, there's so much data being collected from all these elements of the healthcare delivery chain, and then that then can yeah, drive a lot of algorithms, can lead to a lot of AI-driven insights for predictive analytics and so forth, and feedback. And yeah, so but the main thing is that interoperability is the key. That's the advantage of having an enterprise architecture that is like this. So now, having understood that this is what Impilo is like, this is what they're building, this is where things are going, we then are left with the question to say, what about us? What about us who are in the private sector? What about us who are not part of what the government is doing? Yes, we are all beneficiaries by being virtue of being Zimbabwean citizens, that what they're doing is meant for us. It is our government, it's our tax money that is fueling this. But then many of us then are involved as technology developers, as private healthcare practitioners, as people involved in NGOs. Where do we fit in? And to try and get an answer to that question involves us embracing the bigger picture, or understanding where this is all leading. So this takes us to a conversation. It's important for us to understand that the digitization of the health delivery system is just one part of the efforts to achieve digital transformation across government, across the economy, and across society. So it's just one part. So the bigger thing is having total digital transformation of all those sectors, and this is I think elaborated in the Smart Zimbabwe roadmap. Yes, I think that's what they call it, Smart Zimbabwe roadmap. Smart Zimbabwe 2030 roadmap, that's what they call it, which kind of then has plans to digitize government, so that then government does all its services digitally, whether it's taxes and so forth. Then also then has the health ministry there. We can have social welfare there. We can have agriculture there, so smart agriculture is a big thing. So all of that is what they want. So it's all built on this digital public infrastructure, which then is a way of showing how all of this is made possible. The various things that are needed for us to achieve that digital transformation of the economy, of society, as well as government. That at the base here, we have basic connectivity, being connected to the internet, which also then means there's need for provision of electricity, and then the devices. And then on top of that, then we then have systems for single ID, such that then the ID recognized at the Ministry of Health is the same ID recognized at the Ministry of Home Affairs, the same ID recognized at the Agricultural Ministry. And then we have payment systems or that allow transactions to happen at each level, and then data exchange. So these are the pillars, the foundational pillars for digital transformation, that we have data exchange, payment infrastructure, ID, and then all these things that we then see at the top are then just sitting on this foundation. So this could be Impilo systems, then this could be smart agriculture systems, this could be systems for education. If you want to enroll your child in school, this could be a system for smart agriculture. This could be a system for applying for social grants and so forth. So this is what they are building. So Impilo is just one part of the efforts to digitize the entire government, and it's all built on this data public infrastructure kind of model, which is I think many countries are using this model. South Africa announced its roadmap this year, and they are embracing a DPI infrastructure. It's a DPI kind of model. So yeah, that's I think that's where we are all headed, and the smart Zimbabwe or e-government initiative is kind of like heading towards there. And the anchor thing really is data exchange, enabling all these systems to extract information from on the same repositories. Right. Then also now, if we look at electronic health records, it's good to have a bigger picture of what they are. I kind of described maybe what is currently there or what they're working on, but it's good to kind of have a bigger picture of where things are going, and that's where maturity models kind of assist us. For electronic health record systems, there's the EMRA model here by HIMSS, and which kind of then presents several stages of how electronic record system matures. And that initially it can just be maybe paper-based systems, or we can have a system that is only working in one department, not communicating with the lab or imaging, and then bit by bit it then goes to stage 1, stage 2, stage 3. Then we get other things coming in as clinical decision support, or even having all imaging being digitized, so no more film X-rays. All the imaging is digitized, to then up to stage 7, where things are fully paperless. There's mature clinical decision support systems in there. There's exchange of information. Drugs are administered through closed loop systems. So that's where it kind of gives us an idea of where we are going, or what's possible. And it's different in every. This one is the European EMRA model. So what HIMSS what they do is they go around assessing hospitals or private healthcare or health systems, and then give them a score, or whether they are on stage 6 or a stage 3 or 4, so based on percentage of application. So it's different. The one for Europe is different from the one for the Middle East, which is also different from the one from the US. It just shows that in every area there are needs that are there. There are things that we particularly want in our systems, and then those then can be added as we go. So by having this kind of picture, we can then say, all right, maybe what Impilo is at right now could be stage 4 or stage 3, and then what's needed for us to go to stage 5, to stage 6, where we then can begin to see various opportunities for us to be involved in that process, because it just shows, this bigger picture just shows that there's a lot to be done. I think we don't yet have PACS fully integrated into Impilo. Clinical decision support systems are actually being worked on. So there's a lot that needs to be added. And then in the private healthcare setup, people also have different needs. People need appointment reminders, people need invoicing solutions, people need solutions for managing their claims, and that's not referenced in this model. So it's just understanding this bigger picture that we are at the emerging phase of our maturity, and there's a lot that still needs to be done for us to get to the advanced or mature stage where our system is evolving. So there's a lot of scope. There's a lot of work that still needs to be done, even as Impilo then becomes part of the government's bigger digitization efforts. So having realized that, we then can say what are the opportunities or threats for us as people are involved in private healthcare. Like I said, whether you're a doctor or a nurse working in private practice, whether you are someone who's an entrepreneur who's developing systems, you're a vendor, you're selling them, whether you're an NGO that is developing a solution based on a grant, what are the opportunities and threats from all what the ministry is doing? So we can start with the opportunities. Um, Definitely, the main thing is integration, or the better word is actually interoperability. That because they have already valued interoperability and designed the Impilo system to be interoperable, it then means our third-party solutions can come and somewhat be plugged in, that there can be data exchange between private systems and the government systems. They are so committed to this that they are kind of adopting open source technologies and open source strategies, and establishing a community of practice to ensure that then we can develop our own apps that can then feed information into Impilo as well as extract information. So it's a two-way street. So you could be having an electronic health record system being used in in a private hospital, and when it's time to refer a patient to government, then that transfer of that patient should be seamless. You should be the system should be able to send information to the receiving hospital, which is in government, as well as then receive some information from government. So that's quite encouraging, that they built it with interoperability in mind. They didn't close it off, meaning that we can have an app library or a suite of apps that maybe could be approved by the ministry, that could then be integrated and be allowed to extract information as well as add information to then make the service complementary. Like as I mentioned, that Impilo is built in a modular kind of response, so they're adding modules bit by bit, maternity here, family care here and there. So there are still other modules for non-communicable diseases, modules for wellness, modules for some of maybe rare conditions and so forth. So if all of those are developed, they can then be plugged in into that library. So there's quite a lot of opportunity there. Then the other thing to understand is we need to transition towards smart devices. That for several of us members of our society are involved in the supply of medical devices. It's important for us to understand that we're transitioning towards internet-enabled medical devices, that it's no longer advantageous to just use a blood pressure machine that is not connected to the internet, that doesn't relay the reading forward, whether it's a thermometer, it's a blood glucose machine. There's need for it to then, as soon as you have taken your reading, it communicates with the electronic health record system, so that then it's all captured there, to avoid the errors or the redundancies of having the nurse having to type that in. So it means we are transitioning towards smart devices, which then also creates opportunity for wearables to come in. So we see what devices like the Apple Watch, what they do, being able to track someone's heartbeat and detect irregular heartbeats, and being extremely valuable for patients that have heart issues. This then becomes valuable for the record that has been collected by that app to then be shared by the cardiologist, who could be at a parental hospital or at UBH, to then be able to enter that information into the entire Impilo and manage the patient. So there's a lot of opportunity created there if we move towards internet-enabled devices, whether wearables or remote patient monitoring solutions. So there's a lot of opportunity that will create. Then, like I said, understanding the bigger picture of the maturity model means we then can contribute solutions that will allow Impilo to mature a lot faster. It has taken a lot of time for Impilo to be where it is, in my opinion, too long. Part of it has been because of the way it was done, that it was all built in-house. And so they to build their own things. They didn't want to just buy things which is can be a good thing, but then things then become slow because sometimes you end up reinventing the wheel instead of just getting something that is there. But anyway, now they've achieved where they are. If we are to then go to level 5, level 6, or level 7, then we can have solutions that can just be come in and be plugged in. So by niche solution, I mean someone could then just focus on developing a clinical decision support system that has clinical guidelines inbuilt. And then that, as long as it meets all the security standards, all the interoperability standards, can then be plugged into Impilo, and then all of a sudden we then have Impilo going a stage higher on the maturity model. We can have someone specialize on closed loop medication systems, and this is an approach which is different from trying to build everything by yourself, which we kind of see several guys are doing, where they try to develop an EHR system that is the whole cow. But by a niche system, we're kind of saying maybe you are good at developing the hind quarter of the cow, and then you perfect that, and then everyone then comes to for that. And then an example that is, I'm sure much of us are aware of, is what the success that Health 263 is achieved, that they really specialized and mastered the claims submission system. So then everyone then kind of then goes to them, and instead of trying to sometimes just build your own, you just look at what works, what has already been adopted, and then you plug it into your system. So there are a lot of those niche solutions needed as part of that bigger maturity model, things that will then enable us to grow our systems. Then now, big data. Now, if we have a system that is built on allowing interoperability, it then means data from the private system is then getting to the government system. One thing that has been talked about a lot is that sometimes the guys at ministry don't know what's happening in private. So in the private care, like for example, when we had COVID. COVID was a notifiable disease, so doctors had to give ministry daily updates on how many patients they've tested, how many are positive, and so forth. And some of it then was all paper-based, or it was via email, very irregular. But if we have systems that are already interoperable, then it's then possible for the system that is being used in the private sector, which is totally different from Impilo, being able to feed into Impilo. And so we then can get comprehensive data for us to do, much greater data analytics. Even when we then factor in, data from wearables, remote patient monitoring, and other services that the private sector might be better equipped to do, whether if we want to talk about disease prevention and genetic testing and so forth. All that data can then be pushed in, and then we can then do comprehensive data analytics to make healthcare more efficient, remove any redundancies, and optimize services, which then leads to AI solutions. The Impilo is going to collect a lot of data, which then is going to support creation of AI solutions. I've for the past maybe a year or so working with. I've had the privilege of working with UNICEF and some smart guys and in data scientists and AI engineers, and we are building a predictive system for the ministry, so that they can look at rainfall data, look at agricultural output data, and be able to kind of predict the case burden of malaria or diarrhea or malnutrition, just using data that has been collected already from the DHIS2, data from the Med Department, data from Zimstats, and so forth. So that's the kind of AI solutions that we could come up with, all created by having Impilo aggregating data in real time. Then let's look at the threats, and I said threats, but the main one that maybe we might be having at the back of our mind is what if Impilo is made mandatory? That our beloved government just announces that every doctor, every whether you're in public or private, all of you must record on Impilo. The likelihood of that happening, in my opinion, it's low. We have been surprised by our government before, but the likelihood of this happening, I think, is low. It's certainly something that I will not be advocating for, because, like I mentioned before, that in the private sector there are different needs that are there. Some doctors want to do research. Some are super specialists, and the way they want to be able to manage their system is in accordance with how they treat. So forcing everyone to use one system is not recommended. And then there are also user experience issues, that uh, having solutions that are mandated from government might not have, intuitive interfaces, and so forth. So there's no need to then enforce everyone to do that, and also creates a cybersecurity risk when everyone uses, one system. And we've seen ransomware attacks happen in many places in the world where they target health data. So when you then create one system, you then create one pretty target that everyone goes for. The other way they could just say, if you're developing an app that stop what you're doing already, have something within Impilo. Many of the guys in the NGO sector have encountered this. So that's something to consider, to say maybe you are working on a solution for clinical decision support for malaria, and then the Impilo guys say we already have this. Yes, that can happen, but then there are ways to then talk with the guys. It also then means we do away with repetition, because a lot of times there's repetition, there's pilotitis. Some guys do a pilot in one province, and then it ends there. Then other guys get funding, and they do the same thing in a different province, and yeah, that's just yes, it's not good. The threats we'll be getting to discuss, and I'll be happy to hear from you what you view. But just to round this off as we go to our discussion session, what we recommend, what I recommend, what maybe as a society, what we can recommend is that all of us, firstly, is looking at what's within our control, that we all adopt interoperability standards within our solutions. So if you're a doctor who's looking to acquire a electronic health record system for your practice or for your hospital, then ask about interoperability standards. That is it interoperable with systems, because Impilo is already built with interoperability in mind. So there's no point in you acquiring a system, whether from India, from South Africa, from wherever, that then it doesn't adopt those standards, so that then it won't fit into Impilo. So there are standards for architecture, how it's designed. So if you are someone who's designing an electronic health record system, there's a standard clinical documents, what we call a clinical document. It's standard. Some people then I've seen throughout my career various systems, and some people you can just tell they have no clue. So we should look for adopt standards for architecture, standards for health information exchange. So the 807 fire standard, that's what the ministry has gone for. That allows communication between two different systems. The DICOM standard for processing of digital images, that's needed. So we can ensure that our systems have these standards, even ones for naming of diseases like ICD-11. If we do that as private health systems, we then already create conditions that we can then be able to plug into Impilo, and we kind of do that without having to wait for a law where the government has to maybe publish a law that says every system must use Fire or ICD-11. That's not necessary. We can lead the way. We definitely need to make our systems more secure. Because then, if your system does not abide by standards, whether they be multi-factor authentication, it then becomes a risk for the entire system for us for you to just be plugged in. So we need to ensure that we have some cybersecurity standards in our systems. And then what we can do as a society is advocate for clarification on the single ID, the unique ID that the government is using. Like I mentioned, there's the bigger picture of digitization across government, economy, and society, and part of digital public infrastructure involves an ID, a single ID system. So we need to understand from the government to say what ID, what unique identifier are they going to use? Is it the ID number? Is it a special kind of other number? We need that so that when that question is answered, as we develop our system as people in the private sector, we then can get to use that. One thing I see quite a lot is yeah, like some of the guys in the NGOs, when they develop an app, the app will still require someone to enter their name, date of birth, and the doctor where they're working from. This is information that we know already exists. So you can then imagine having to do that across many systems. But if we already have one unique identifier, then we just can then tap into that. Then ultimately, we all encourage you to kind of ride the wave that we look at the introduction of Impilo as something that is very positive for the growth of our digital health industry. Because it's helping us. The government is kind of setting that minimum standard for health delivery, and then we then as people in the private sector can then build on that. Because having been in this for years, some people are very reluctant to digitize. But then, if a patient who is coming from a rural area, such as Uzumba Maramba, which is where Impilo was started, if they are used to using digital health records, and then they come to Harare to see a specialist that they have paid $120 to see, and then the specialist is still using paper-based system, it won't make sense. So what the government is doing by pushing for digitization is actually going to lift. It's a tide that's lifting all boats. So we should ride the wave and see this as a positive development. Right. So yeah, we can go into the question section. Okay, I see Q&A. If you want to, okay, I see Lloyd, you've raised your hand. Right. Right. You can make your contribution, Lloyd.
Can you guys hear me?
Yes, sir.
All right, cool. Yeah, so I just wanted to ask around, your data storage, because you mentioned that, you want to have a unified data store where private sector can just sort of probably using that unique ID, which could be an ID number. We just query that database and get all this data. So my question is, where are you storing the data? Is this on-prem or you're using some cloud providers to store the data?
Okay. Firstly, this it's not me. I am not part of the government or this effort. But what I can share with you is that they do have a national data warehouse I think there was a slide that is there, and that's where all information is going. There was one. I wonder if it was true what I was told. The location for where all the government's data is going to be, like the physical servers. Someone had said somewhere close to where the Minister of Defense is, but maybe that was just someone saying rumors. But there is a national data warehouse where all information is going to be stored.
Okay, yeah, so for private sector trying to contribute and integrate with Impilo, what are the standards for our data storage? Are we also do we also have access to these data centers, or do we need to um, sort of like, seek other public uh, data providers, or
All
because
right.
I mean,
Yeah, so what we were talking about with the interoperability, it's to say a private care you can store your own data on your own cloud or on your own servers. It can be there. But what's needed is it's information exchange because, like with patients, people move from one sector to the other. What's all important is information exchange or being able to retrieve information from there without necessarily saying all of our systems have to be hosted on government data. So we in the private practice, people that are EHR vendors, people like myself and others, people set up their own data storages. So what's just required is exchange of information. All right. Anyway, thank you very much, Lloyd. Let's see some of the questions. What are the main benefits for hospitals and patients as they progress through MRAM stages? Well, if you go through MRAM, then it's really about maturing your system to be able to provide comprehensive service, such that everything that is done at a facility will then be paperless. So you can, in the stages, one could start with lab and pharmacy, and then you add things such as the imaging, and then you now add clinical decision support systems. These are like AI kind of systems that enable the doctors as they make their diagnosis. And then as you keep on going with closed loop systems for medication delivery, it means things become more secure to reduce the chances of someone being given the wrong dosage and so forth. So yeah, there are lots of benefits that are there. Um, then what are the recent opportunities of using wearables and remote patient monitoring in low resource settings? Um, I don't think the opportunities, yes, there are more opportunities than there are risks. Um, Risks, I think, yes, cybersecurity is always an issue, whatever. But and then the other thing is ensuring then that the wearables are of a good quality, that they are collecting adequate data, so that we then just don't get systems that lie. But where we are going, wearables, if you look at diabetes, someone who used to prick themselves every day, now they have a device under their shirt that is just taking readings continuously from the skin. Yeah, that's a massive benefit. So that's where we are going. Um, so Natai asks, to allow interoperability, will you share APIs to connect easily from with the preset? So again, it's not me. I'm here as someone like you who's in the private sector and someone who's here on behalf of the Zimbabwe Digital Health Society. But what I would say is, according to what the minister is working on, the answer is yes, that they will allow that integration, whether it's through sharing of those APIs. So they are open to that. I think the process might then be, if you have something that you meet with them. I think they actually worked on a checklist I wonder if they finalized it, but some basic things to say before you approach the ministry, please tick these boxes, ensure that your system is A, B, C, D, E, F, G, and then you can then sit with ministry, and then when ministry says, okay, this is fine, then they can then issue those APIs. Because the challenge, particularly during COVID, they were getting bombarded with a lot of requests. People coming up with solutions for vaccine checking or health sharing of, yeah, there are a lot of requests that were coming in, and some of them are good, some of them are bad. So they had to come up with a part. The impression that I have from their documents and interacting with them is they are open to sharing those APIs to allow integration, because that's in how we can really maximize the benefit from Impilo. Right, let's see, there's more hands raised. Just give me a second. Right. Admire, you can go ahead.
Good evening, Mr. Ralph.
Good evening, Admire. How are you?
I'm all right. Thank you so much for the presentation. The future is exciting. However, I feel that there is a huge gap between where we want to go and where we are. I normally sit down with a lot of medical institution directors and leaders. Um, they we need like standards, basic standards that can assist us to insert these systems maybe in a more mobile friendly setup like tablets and even on smartphones. Are there any standards that support or like going towards that? Because the basic systems, like as you were saying in your presentation, there will be AI integration, like the models you were talking about. How are we shaping towards mobile friendly um, information systems for these medical setups?
All right. I'll try to answer it. Right, let's maybe as quickly as I can. So with you mentioned standards, maybe something to do with the devices. So that's to do with procurement. So with ministry, with their own plans, I was working on a project with them when we were looking at village health workers, and there was then need to spell out the minimum requirements of a tablet device or a mobile phone to be procured, because although the minimum specifications, because various NGOs would buy different types of hardware, and they'll then give them out to these village health workers, and then some of them will then break down, and some of them will be good, some of them are too expensive or unnecessary, and so ministry was going to then issue out those minimum requirements. And so far, where they are setting up Impilo, I think there is a standard that they've accepted in terms of specifications for hardware. But the focus for us as people that are in the private sector is we have to. Uh, for us, it's kind of simple in that if you implement something that's not business worthy, then people will just go on to the next person. So when you mention things about having technologies that are mobile friendly or user friendly, if you're a person who is in business, you're a vendor, you've developed your system, you want it to be acquired. If the interface is not optimized, then yeah, you might lose out on business. So one of the things that we are trying to do, like you rightly mentioned, that there is need for standards. So that's why in our recommendations is to say, let us adopt at first, even as we build our things, standards for architecture, standards for information exchange, standards for nomenclature. We can direct that process. Perhaps we can even get together as the Zimbabwe Digital Society and issue out our list of those standards without then stifling everyone, because systems have to be different. Some interfaces can be more intuitive than others, so we don't have to really prescribe it down to say this is what you should be. But then there are those minimum things. Yeah, I guess we can take it up as something that we can work on as together as a digital society, and issue those guidelines for us as people that are in private sector. Because for us, it's important to have solutions that are usable and well adopted. Ministry, they have their own guidelines. Maybe they can borrow from us if we continue to be well organized. Right. I think our time. I'm going to Prof. Nazem, I see you, so I'm enabling you to talk. But as you log in, there's one question here. How about data security within Impilo? Are patients being able to choose what they would and wouldn't like to share? I think they haven't gotten to that stage, but it's something then that we hope to be able to weigh in as a society and say this is what we would advise. Ideally, people should be having that control on what they can and what they cannot share. In the electronic health record system that I'm involved in, we kind of give that control to the patient, if I may say, that they then are aware of where their information is going. It kind of then follows standards or best practices from other countries. So the ministry I think, is yet to get to that stage. Because right now it's just information that is being shared within ministry itself. So if someone has been seen by this clinic and then you've been referred to a hospital which is in government, it's still within there. And then at DHIS level, it's anonymized data it's aggregated anonymized data. So yeah, we'll soon get to that discussion. Prof, please go ahead.
Oh, yeah, thank you very much. Mine is just a comment on the issue of threat. I think we shouldn't underestimate our government, given the experience that we've gone through all these years, for example, this COVID situation. So what I would suggest is that I think there need to be an education of the consumers, so that at the end of the day, they appreciate what digital health is all about, the quality of care that they get. And then the government can then use it. And also, at the same time, I think they need to introduce...
Prof, you're coming in and out, so maybe you might need to hold your microphone close to you because
okay.
Yeah.
Okay, can you hear me now?
Yeah, much better now.
Okay, I was just saying, please let's not underestimate some of our people in government. There are some people who can be excitable. They may push that this thing has to be adopted, but to do that, they would need to just educate the general public that it's all about quality of care and so forth and so on. And also I think we need to push this whole idea being introduced in the curriculum of our medical students, pharmacy students, and the nurses, so that at least by the time they come out and come into the private sector, they are very much aware of what's going on. I just thought I would just suggest that. Thanks.
Thank you very much, Prof. Indeed, as I mentioned, Impilo, it's a massive undertaking. It's not just like training of the healthcare workers, like you mentioned, it's also training of the consumers themselves. So I think bit by bit, as funding is allowed, they're going through stages. So there was a time when they were doing massive training of healthcare workers from all the provinces. So, starting off, ensuring that the nurses and the doctors know what Impilo is about, and then once they are used to that, then maybe they can then cascade and start making noise about it to the people, because as any government, they will not want to sit on good news. I'm sure many of them would actually want to, for the message to go out there, but they're doing it step by step. And for us as private, like you mentioned, that there's quite a great opportunity for us. So one of the things that is kind of painful in this transformation process, from my experience, when I help a surgery, go digital, there's a lot of training that we have to do to train the doctor on how to use the system and the nurses and so forth. But as Prof mentioned, if we have our student nurses and student doctors who are trained in public hospitals that are using Impilo, When they then transition to private sector, these are people that are already accustomed to using an electronic system, and the training then won't need to be that extensive. So, like I mentioned, this is an opportunity for us to ride the wave that what the government is doing is a positive development for all of us that are in the private sector. Ladies and gentlemen, we have gone beyond our time. Unfortunately, I'll have to end it here. Thank you for taking the time to join. The recording of this will be made available through our LinkedIn page. We ask you to stay tuned to our LinkedIn page, subscribe, follow there, so that you are up to date as even when we share more developments regarding membership and so forth. So thank you so much for taking time. Thank you for the great discussion. Even questions and comments, we can continue them on that on our LinkedIn page. We can continue to interact there. So thank you so much. I wish you all a pleasant evening, and you're all invited to our next webinar.